So I like that. Challenges with benefits. We all have challenges, but this is an area that we definitely have some benefits. And Florida has always been seen as a leader, and we have great leadership leading the way. So we're going to transition into Dr. Paul Gleason. And he's just going to kind of kick it off to let us know, what is Health IT? Why do we even say, why do we care? Why do we care?
A little higher. All right, again, as she mentioned there, I'm Paul Gleason. I am the Chief Medical Informatics Officer, former CMIO at Baptist Healthcare in Pensacola, and now over Physician Quality at Baptist Healthcare. And also, I should let you know that I'm the board chair for SHI, the Strategic Health Intelligence, run by Craig Dalton, who's here in the audience here in Pensacola as well, the Pensacola HIE. So thank you, Pam and Heidi, Carrie, for inviting me. It's a great honor to be here and talk for a few minutes and give a physician point of view about what's going on in Florida and our state of health here. So a lot of this will be coming from a physician point of view. I will mention that I am a DO. That wasn't in there. I'm very proud of that. So I'll just let you know that. So I am carrying the flag high. Can I push it? So I want to start out by just saying that there is a little bit of a medical crisis going on in the nation throughout there. So you hear about this all the time, but it's not so much about the money, it's more about the meaning of what medicine's about. Like yesterday, the whole news was about the Affordable Care Act, the Supreme Court, and I kind of look at that and say, wow, I think everyone kind of missed the point. It's not really about how we pay for this health care, but it's how it's delivered and the meaning and the humanness about being in the healing art. The healing art is this ancient lineage that's been passed on since Hippocrates all the way down through the ancient Greeks, all the way through where we are today. So maybe that's a little bit that's been missed, and that's, I think, what's been part of the crisis going on in medicine right now. So if you look at this, next slide here shows a Medscape poll that was done in March 2015, where they polled over 19,000 physicians here and said, hey, are you really happy with what's going on? And so of the 19,000 there, a lot of them said, no, I'm completely burned out. In fact, most of the specialties said they were at least 50% burned out. These are the top offenders right here. Critical care medicine, obviously they're in the trenches there quite a bit, and they have a very stressful job. Emergency medicine, which is my background here, number 2, and that's in fact why I got into in IT, is because I found myself being this mean and hateful person that I'm not. I'm a hugger, and I found myself being, it's like telling grandmas, get up off that gurney, let's go. You've got one good hip. So that's not me. So I had this epiphany where I kind of said, let's step back from this and kind of see where medicine's going, and I decided that I wanted to be in the forefront of making the change through here. So that's kind of what I'm involved with. Family medicine, I know they're burned out because there's not enough of them. There's probably not enough by half or a third. They could easily triple their numbers and probably still not get enough primary care in America. The average person waits 18 days to get an appointment to see their primary care physician, so that's probably just not where we need to be by a long ways. General surgery, I think they were probably unhappy to start with. I'll skip over them. There's no surgeons in the room, so it's a love-hate thing with the ER guys and surgeons. So HIV, infectious diseases, a lot of this stuff you just can't fix. You just see these patients over and over again, and you feel so bad yourself that you can't help these people more than you. So I know that contributes a lot to their burnout rate. These are the physicians just for fun that are not burned out. Dermatology, of course, at the first there. I'm holding back, I'm not sure they're just really not burned out, or they just smile a lot. I don't know. They have a lot of access to Botox, so they're probably just stuck that way. And these other ones you see here, they've got a pretty good life. But even then, ophthalmologists, how hard can their life be looking at eyes all day? They probably enjoy their work, but even for them, 41% of them are burned out. And they say, I just can't take this anymore. So this is where I'm coming from. This is what I'm saying, that there's a medical crisis in America, and it has nothing to do really with so much IT. It's just one small part of it. The Wall Street Journal picked this up here, a recent article there asking about why doctors are sick of the profession. And it's such a multifocal point there that you really can't get to it. But Sermo, I don't know if you guys have heard of Sermo. It's an online physician community there where physicians kind of go and rant with each other there. So this was a ER doctor I thought was really good. He just said, I wouldn't do it again. When asked if he enjoyed his profession, he said, no, I wouldn't do it again. It has nothing to do with money. I get too little respect from patients, physician colleagues, and administrators, despite good clinical judgment, hard work, and compassion for my patients. Working at patients in the ER these days involves shotgunning multiple unnecessary tests. Everybody gets a CT scan, despite the fact that we all know they don't need them, and being aware of the wastefulness of it all really sucks the love out of what I do. I feel like a pawn in a money-making game for hospital administrators. There are so many other ways I could have made my living and been more fulfilled. The sad part is we chose medicine because we thought it was worthwhile and noble, but from what I've seen in my short career, it's a charade. So that could be from a lot of doctors that I know, say that every day. So a little bit of a crisis, but how about patients? Are they burned out too? It's probably more than just the food he's getting there in the hospital there. This is their reality, right? These are the words they hear about healthcare. They don't hear about compassion, your primary care doctor coming to your house now with a little black bag, about how your primary care doctor saved Aunt Fanny, how she delivered your Uncle Joe at home, or these great stories that my dad told me about his primary care doctor. You hear about managed care, Obamacare, you hear that word, it's almost become like a bad word now. You hear about exchanges, and people don't really understand that. Medicaid expansion, LIP, apps, co-pays, they're going high, but I'm not sure. How do I get access? Most patients go to WebMD. They've had millions of hits every month there. Most people get their health care from WebMD. That's the biggest provider of primary care in the country. Certainly, the tax penalties for this, the federal poverty level, what does that mean? Where did that come from? Why do I have to be pre-authorized to get an MRI? I don't understand that. Non-formulary drugs, these narrow networks for both physicians and systems, and then they just get really frustrated with non-coordinated care. So I think patients are probably burned out as well. It's not what we signed up for. So when we signed up for this, and I won't give you my age here, but I know that what I signed up for there is what's on the right-hand side of this. I signed up for the Norman Rockwell picture. I wanted to be the family practice doctor that comes to your house and kind of gives you a hug and gets you through it and says it's just chicken pox, you'll be okay, or take some Tylenol and call me in the morning. So in 1973, only 15% of the physicians polled had any doubts they had made the right career choice. This is the greatest career ever, right? The highest calling, God, and then doctors, right? That's the old lineage from that. But by 1981, half of them said that they're not so sure they made the right choice. And this is just despite of the fact that doctors make quite a bit of money. I mean, inflation adjusted, it was $185,000 back then. They were making pretty good money. Now this inflation adjusted about $161 on average for their income, but what the caveat is they're seeing twice as many patients. And then you have to deal with all the things that we don't want to deal with. Certainly I signed up, I was an ex-Navy guy, I signed up for the poster on the left, right? This is what I was like, I thought all the women wore these suits, and this is great, sign me up. And when I got there, actually it was more like the right side, swabbing the deck. I'll never forget every day when I was on a ship there, they had a thing called sweepers. I don't know if you guys are any military Navy guys. And every day was in the quarters, this, and then sweepers. And I was like, is this like a movie they show? What is this sweepers thing? And then they're like, no, idiot. Sweepers is where you get a broom and you sweep the ship down every day. I'm like, what? I didn't sign up for that, but every day at 6 o'clock you did sweepers. So that's what we signed up for. This is what I think I signed up for as a doctor. I said, hey, this is great. I want to be able to give great news, give great care, give compassion, have reverence for the life of the patients who we're taking care of. And I want to get a lot of hugs, and I want to have a lot of smiling, happy faces, and a lot of appreciation for what you do. But this is reality for physicians right now. They hear words like this: EMR, malpractice, again, Obamacare. They're worried about social programs. Most of your patients have other issues at home. Not all of them have substance abuse issues, but there are a lot of patients, and we know this in Florida, right? There's a growing number of patients who have substance abuse issues, and the doctors are contributing to that. ACOs, do most doctors even know what that means? Probably not. They just certainly know what HEDIS and PQRS measures are. They have to deal with burnout, chronic conditions they can't cure, like HIV, diabetes, and obesity, and they have to worry about this primary care shortage. ICD-10, that's only begun to hit. That's the nuclear bomb you see on the horizon going off and the dust clouds coming towards you, and it's too late to run. It's at the judgment day, like Terminator, it's coming. There's nowhere to run for it. I'm just going to deal with it. Then we have to worry about retail medicine and these marketing things. Is my clinic now is it even relevant anymore? I'm not sure. Patients want to come to the doctor at 2 a.m. because that's when they're up. It's just, I don't get it. My office's hours are from 8 to 9:30 and from 2 to 4 in the afternoon and I'm closed for lunch. This is the old mentality of doctors when they deal with things. So, so this is what they're having to deal with. So how do I know this? How do I get this list right here? Well, I spent about a day in the doctor's lounge, and I spent a lot of time here. This is our doctor's lounge at Baptist Hospital there, and I hear lots of things. And this is the doctors, what they complain about, and the EMR is only a small part of that. I just did a stint, I'm into musical theater real big, so I was in this, have you guys ever heard of The Music Man? Probably one of the most popular musicals ever written. So I was in the opening train scene, and it's a huge dialogue there. It took me weeks and weeks to learn this dialogue. It's pages and pages, but anyway, the line I can't forget is, you can talk, you can talk, you can bicker, you can talk, you can bicker, 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 you can talk, you can talk, you can talk all you want, but it's different than it was. And that's what these guys are saying right here. So I still got it. I still sweated that out every night, though. I was like, I'm going to forget that line. It goes on for like, I don't know if you guys have ever seen it. It's like a 15-minute scene. It's unreal. So that's what's going on now. Lots of bickering, lots of talking. That's what the guys are talking about. So this is the real boardroom of the hospital there. If you need anything done, you have to go be able to sit in this office. I mean, in this room right here and wear a white coat. I talked to him, but I think, this is my hypothesis, is not really dealing with burnout for the physicians. It's more like change fatigue. That giant list of things going on, and IT is only a small part of that, right? But you get so much, this is like your brain being opened up and things just pouring in there, and I just get change fatigue. I can't deal with all this change at one time. So I'm not sure if you guys have ever heard a book by Jonathan Haidt called The Happiness Hypothesis. If you guys haven't read that, I highly recommend it. It's one of the best books I've ever read. But he came up with a hypothesis that said basically happiness is equal to your set point plus your conditions plus your voluntary choices. So happiness in your life comes from where you're kind of born with a certain amount of happiness, and then you kind of live in your conditions. You either have good conditions in your life or you have poor, and then you have these voluntary choices that you make. But the key is voluntary. If you don't have those voluntary choices, you're unhappy. You don't have any control in your life, and that leads to discontent in your life. So I think a lot of doctors right now are dealing with the voluntary part they're not getting. Even the AMAs talked about this. They have a new president here, Stephen Stack, who's a fellow ER physician and just a really, really sharp guy. I'm really glad he's taken the reins here for the AMA. He basically ran on 3 agenda items. Number 1, he says, I think there needs to be a fundamental change in the way we do medical education. That's great. The DO's got that over 100 years ago, right? So we were on that before them, but anyway, so I get it. So they're moving with that. So they want to change the way they do this and not really make doctors come out to be hardened, just hard line, just the facts, ma'am. I'm sorry you have cancer and you need to deal with it and walk out the room, right? So they want to get more humanity back into medical training. Great idea. Number 2, he says, I want to have hard, fast interventions that are hardwired in our education and to our practices there to deal with 2 things, hypertension and diabetes. And he thinks that this contributes to 50% of the healthcare costs in America. So if I can fix these 2 things just halfway, we'd save 25% of our healthcare spending in America. Great idea. Number 3, out of nowhere, he calls out EHRs. He says, I want to eliminate the burden of EHRs. What a random thing to say, but he kind of just went right to the point here. So for us in IT, is taking the point to heart. EHRs have such an incredible promise, and that's what I focus on, the promise. We promise these things are going to make your life better, but they have inserted such incredible frustration in the physician lives and diminished their efficiency. So this is the 3rd tier of what the AMA president is running on.